getting out while they still can. These passengers are on the last flights out of Kathmandu as Nepal suspends international air travel. I'm glad that I'm able to leave Nepal, where the COVID-19 situation is getting really bad. Like neighbouring India, Nepal is reeling from a deadly second wave of the coronavirus. The porous border between the two countries has contributed to skyrocketing case numbers. Nepal's main towns and cities are in lockdown. The Health Ministry says the situation is unmanageable. Doctors and nurses are being pushed to their limit. To date, we have not turned anyone away without providing them with oxygen. But the situation is getting complicated. Our colleagues are working very hard. They are on duty for 24 hours. We have even been giving oxygen to patients in chairs. Nepal has called for international help. As case numbers hit record highs, the country's neglected healthcare system is facing collapse. With the lockdown in place, many migrant workers have returned from the cities to their homes in rural areas. While Kathmandu's hospitals struggle to save lives, fear is growing of outbreaks in the remote regions lacking healthcare infrastructure.
And let's bring in now Azmat Ullah of the International Federation of the Red Cross and the Red Crescent Societies in Nepal. He joins us from the capital, Kathmandu. Thank you so much for taking the time to speak with us. Your organization is helping there on the ground. What's most urgently needed?
As your report just said, the situation with the second wave of COVID is very deadly and alarming. And just to give you some quick figures, just in the past few weeks, the COVID rate has increased by about 50 times. And in March, we were talking about 100 infections a day, but just in the last few days, we're talking about over 7,000. The death rate is also unprecedented in Nepali standards. We are talking about over 50 deaths each day. This is also very, very alarming. The IFRC works with the Red Cross volunteers on the ground. The Red Cross volunteers are very, very active in dealing with preventive measures, support to national and medical services, as well as vaccination efforts. And as you may also be aware that many of the richer countries, we're talking about a rate of vaccination about 30%, whereas in Nepal it's barely 1% at the moment.
Is it set to get worse than in India, you think? I mean, you've been on the ground there. In fact, we're going to see some footage, that you sent to us, in fact, of how you have been experiencing this firsthand. Where do you see the trajectory going right now? Is it getting worse? Is it getting better?
If you look at, it's definitely getting, it's very bad at the moment. India has about 48 times the population of Nepal. And if you multiply that by the number of infections, which is over 7,000 a day, and a death rate of 54, 55 a day in the last few days, the figures are very close. And if we do not do anything fast to put the situation under control, it could be just on par with the situation in India.
What do you need to get the situation under control, in your view?
The three main things. The Red Cross is very active on the preventive measures in 22 of the 77 districts in Nepal and Kathmandu, the Kathmandu Valley, where there's a lot of infections. Volunteers are dealing with safety messages, hand washing, social distancing, supporting quarantine, and promoting vaccination. The second is that a lot of volunteers are also helping national and local authorities with medical services. And in your report, we are talking about lack of oxygen in hospitals, and there are also lack of frontline workers in the hospitals. And you will see in some of the hospitals, people are just lying on the floor. And Finally, vaccines and vaccination. The Red Cross has also been supporting the public authorities, the health authorities in getting vaccination in the arms of people. But right now, there's a huge shortage of vaccines. And this is an area that we really need to do more with the international community. And with COVID, not only in Nepal, but around the world, I want to stress the fact that no one is safe unless everyone is safe.
That's a really important message, and one that we thank you for joining us here on DW News to share. We also thank you for the work that you are doing there. Azmat Ullah of the International Federation of the Red Cross and the Red Crescent Societies in Nepal. We appreciate it.
Thank you.